New at 5:30, Covered California's 12th open enrollment period is underway. Action News Now reporter Blake Mayfield spoke to officials at the Reading Library to find out if potential cuts or changes to the Affordable Care Act could affect patients.
I'm here today at the Reading Library, where Covered California is making its latest stop on a statewide tour, informing folks about open enrollment. The insurance agency is teaming up with libraries in particular to help people gain better access to its resources in 2025.
So many times I talk to people as the director of the library, and they're like, oh, you work at a library. Like, do people still go to a library? And yet libraries have never been as busy as they are now because there's so much information.
Nearly 1.8 million Californians are currently enrolled in Covered California. Covered California says more than 1.3 million people in the state who are eligible for coverage go without. 125,000 of those people live right here in Northern California.
If something happens later in the year, like you lose health insurance from another source, you can come in under special circumstances at any time.
According to Covered California, as of last year, the state's uninsured rate is 6.4%, a record low. California's uninsured rate has fallen nearly 11% since 2013, the largest percentage drop for any state in the nation during the Affordable Care Act era. President-elect Donald Trump said in the months leading up to the election that he would repeal and replace certain aspects of the Affordable Care Act if he saw fit. So I asked, could that affect Covered California patients in 2025?
Open enrollment is here right now, and people can enroll, and there's no reason to think there will be any changes for 2025 coverage.
The Shasta Community Health Center says it sees more than 4,500 patients every year who are on a Covered California plan. Nearly 1,200 people have already enrolled for Covered California through the Shasta Community Health Center this year.
I had a young man, individual, about 30 years old, wasn't insured at all, got diagnosed with something with a chronic illness. We were able to get him insured, get his medication at a reduced cost. He had applied for the California Highway Patrol, but he couldn't get in because his chronic illness prevented him from getting past the exam. He was able to take the test, passed it, is now got into the California Highway Patrol recruiting field.
Open enrollment for Covered California is open from now until January 31st. Reporting in Reading, I'm Blake Mayfield, Action News Now.
If you want health coverage for all of 2025, though, you need to enroll by December 31st. We have a link where you can do that on our website. And if you enroll before the new year, your coverage goes into effect January 1st.